Thank you, Chairman Fleischman, and thank you for members of the committee. We are here and we are introducing two residents in our town who have been very actively involved in allergy issues, two parents of children with allergies, and I've been working with them for close to 2 years now, and they have here to testify regarding the bill, and I left my testimony up in my office, HB 6975.
I hope we're not taking up any of their 3 minutes. Their testimony is much more relevant. But thank you, Chair, and the committee for hearing this.
Chairman Fleischman, Chairman Schlossberg, members of the Education Committee. For the record, my name is Jessica Curran, and I am here today to testify in support of House Bill 6975, an act establishing a task force to study life-threatening allergies in schools, food allergies in schools. You also have my written testimony. Thank you for the opportunity to speak today. As a parent, it is hard to put into words what the moment is like when your child is given the diagnosis of a life-threatening condition. That sentiment is compounded when the diagnosis comes with the knowledge that there is neither a treatment in hand nor a cure in sight. To say that the diagnosis of anaphylactic food allergies is life-changing is at best an understatement. I have lived that moment twice, 5 years apart, when each of my twin sons were diagnosed with life-threatening allergies to peanuts and tree nuts. To be told that your outwardly typical and robust child can go into a systemic medical emergency within minutes of exposure to the most seemingly innocuous of threats alters both how you parent and how you live. But actually witnessing your child go into anaphylactic shock forever alters the landscape of your life. I say that with certainty because I have been there. A parent's responsibility is to protect our children, so with that diagnosis of anaphylactic food allergies, we must learn to navigate a new territory of constant vigilance. We follow a prescribed medical protocol of strict avoidance of allergens across all environments at all times. We train ourselves to recognize the most minute symptoms of anaphylactic shock. We do everything we can to protect our children's lives every day, day in, day out. We do all of this while also trying to normalize the lives of our children. It is by no means a small feat, especially when it comes time to send our children to school. Considering the current prevalence of food allergies, one would imagine that sending a child to school with this chronic medical condition would be concerning but manageable. There are state and federal guidelines related to the management of life-threatening allergies in schools, legal protections providing for accommodations, and myriad resources available to help parents and school districts collaborate to ensure our children are able to fully participate in their education while still being kept safe. Somehow, somewhere, the system is faulted. I'm here today representing a growing community of parents who are concerned about the safety and inclusion of students with life-threatening allergies here in Connecticut. Many families who are too fearful to advocate in this type of way due to the potential retaliation or backlash against their own children. It is the reason I first reached out to Representative Kupchick a year and a half ago as I was experiencing tremendous difficulty within my own children's school with regard to the safeguards I had been told were in place to keep them safe, healthy, supported, and included, but in fact were not. It began a battle I was not prepared for, so once again I had to quickly adapt and learn. When I walked into a Board of Education policy meeting 12 months ago to raise my concerns and question why we did not have a comprehensive food allergy policy in place despite an 8-year-old state mandate, I was floored by the lack of awareness and understanding at all levels, from board members to administrators, staff, and parents. It has taken a full year riddled with battles on issues that should be considered standard best practices and adherence to the law, halted by community outrage, fueled by a lack of education and a lack of empathy. While I can say that late last night, after a full year of discussion, food allergy policy was indeed passed in Fairfield, I cannot say that I feel the issue is now fully accepted or understood. My story and my school district are representative of so many here in Connecticut. I ask that the Education Committee consider this task force as a first step in remedying the significant barriers to safe and equal access to school for food allergic students. Thank you.
Thank you. And you have a fellow parent who's sitting quietly beside you. I imagine you have some prepared testimony as well. Is it testimony that you've submitted to the committee?
Actually, I did submit testimony, but I've got different issues I'm addressing here because there are so many complexities.
If you could present that in a way that sort of hits the highlights without going through every single detail, that would be welcome.
I will do my best.
Thank you.
Tricia Donovan, Fairfield. Good afternoon, Chairman Fleischman and Schlossberg, and esteemed members of the Education Committee. I am also here in support of House Bill 6975, an act establishing a task force to study life-threatening food allergies in schools, and that is a mouthful. I would like to thank you all for raising this bill, which affects so many of our families, as you have just heard, and our children in schools today, and their ability to learn in their school environment. In Fairfield, Connecticut, we have 10,000 students in our district. More than 800 students are affected by some sort of food allergy or intolerance, and 470 of those are diagnosed as life-threatening food allergies. And I am the proud mother advocate of 2 of those children. My children have multiple life-threatening food allergies. They cannot eat any dairy products, any eggs, any peanuts, any tree nuts. And I have been navigating the world and guiding them through the world of food allergies for the last 15 years, over which time the landscape has changed dramatically. Naturally, I was thrilled when the state guidelines came out in 2006. But there is a huge mismatch between the standard of care that is required by the state statute and the language that is provided in state guidelines. As you heard from my very good friend here, Jessica, we've spent the last year in policy committee trying to take the language in the guidelines and make it a policy that we can put in place in our classrooms, in our schools, to keep our children safe. While districts are required to implement these management plans based on prevention, education, awareness, and communication, and finally emergency response, that should always be the last thing, the language does not give school districts or decision makers who are not experts the guidance they need to operationalize. I and other parents spent enormous amounts of time in research and education of people on the committee. Within these guidelines, the schools are said they should consider prevention protocols, but if the state mandate is to prevent, then schools must implement, not consider prevention protocols. The suggested protocols that are included are presented as an a la carte menu from which one can choose whatever they like without there being any rationale related to those that are medically based best practices, best for different stages of child development, or best for available school resources. Additionally, education and awareness are an integral part of successful prevention measures and affect how well our children are in the classroom and accepted among their peers. Many times my children have been left to educate their peers on their own without any support or guidance from the schools. Recently, my son related a story from the lunchroom. He was sitting with his friends. We have successfully transferred him from the peanut-free table, which feels like the punishment table because you're isolated from your friends, to a normal lunch table. He's in 6th grade, and he related a story where he was eating chocolate chip cookies, and his friend said, "I didn't think you could eat that." And he said, "No, I can eat chocolate chip cookies." And he said, "But you're allergic to chocolate." He said, "No, I'm allergic to dairy. There's no dairy in chocolate." And his friend said, "I just don't understand why you haven't died yet." So there is a huge gap, and in his innocence, they want to know more. They want to be educated in how to take care of their peers. So while the guidelines promote education, they do not provide the means to do so. The state education department should provide modules in our health curriculums. The Department of Public Health should vet and make available to schools some of the educational videos and online resources so school districts are assured a minimum standard of evidence-based information that is also developmentally appropriate for our children. In addition, when I was looking at the guidelines for diabetes management, there is a huge section on inclusion and how important that is to our students who have chronic health conditions. Not once is inclusion mentioned in the state guidelines on food allergy management, and that is a huge roadblock for many of our children who are told to suck it up and you can just eat something else, or you can just not touch foods that you're allergic to. When a child is in the learning environment, they can't just extricate themselves from the building, from the classroom where they feel unsafe. And if children are feeling unsafe, they are not learning. The charge of this task force should be not only to study food allergies in our schools, but how to resolve these issues of implementation. They need to establish data collection that would inform policy implementation and give districts the ability to adjust their policies accordingly. I would also like to ask this committee to reconsider the composition of the task force to better reflect the knowledge base of those who are most affected by this issue, like older students, more parents, nurses, teachers, administrators. Those are the people who are affected daily and who see this implemented every day in their lives. Thank you.